Together we achieve victory over heart failure.
Hello, I'm Dr. Vaikup, also consultant cardiologist, who was on hospital Hyderabad. As we all know that despite remarkable breakthrough in the pharmaceutical interventions as well as catheter-based interventions, nowadays the cardiovascular disease-related risk in the form of fatal or non-fatal myocardial infarction, fatal or non-fatal heart stroke, fatal or non-fatal heart failure, including sudden cardiac death is encountered. There are several reasons triggering for the development of acute myocardial infarction of the heart failure. As we all know, the most important triggering factor in our country is the hypertension. Apart from hypertension and diabetes mellitus, dyslipidemia, lack of physical activity, excessive calorie consumption, lack of physical activity, and undue mental stress, all contributing to the greater incidence of acute myocardial infarction, the fatal or non-fatal MI, non-fatal stroke, and heart failure. As we all know that there are several myths which are prevailing in our community, in our society. The most important myth that is prevailing in our myth is that heart failure only affects the elderly. No, it's not very true. The heart failure may encounter any populace which might be either related to either valvular heart disease, particularly in children and young people, and even women also they tend to develop heart failure, particularly in late pregnancy. We oftenly connotate it as a postpartum or peripartum cardiomyopathy, as well as in middle age or younger people, and even in elderly people. The most important triggering factor contributing to the onset of the heart failure in elderly or middle age is hypertension and diabetes. Sometimes undue mental stress also contributing to development of heart failure, and sometimes alcohol. When people nowadays, young people are consuming lot of alcohol and caffeinated beverages. The alcohol can cause cardiomyopathy and ultimately transgress into degenerated into heart failure. So, and in elderly, most of important reason in elderly people is the hypertension and diabetes and chronic kidney disorder. Then we have a next myth in prevailing that is in our country is the heart failure means his heart is stopped completely. It's not true. The heart failure doesn't mean his heart is stopped completely. Only the pumping function, the heart efficiency was lower. We know that the heart efficiency or ejection fraction normally should be more than 60%. If it's less than 45%, we often call it as a heart failure with reduced ejection fraction. Heart failure with preserved ejection fraction is more than 60%. So it doesn't mean it is a completely heart stop. It's just heart efficiency was decreased. Another myth that is prevailing in our country is that long-term smokers can't lower the risk of heart disease by quitting. It's not true. Even the smokers often tend to develop coronary artery disease, which eventually leading to ventricular systolic dysfunction and ultimately culminating into recurrent episodes of the heart failure. That's very common in smokers. Another myth that is prevailing in the community is that I should not exercise after having heart attack. It's not very true. Once after once heart attack is subsided, either with the medications or with angioplasty stent operation or with bypass surgery, once his ejection fraction is improved, he can start an exercise within 2-3 weeks after angioplasty stent or 8 weeks after bypass surgery. So exercise can be started even in patient with heart attack, even if the patient underwent angioplasty, even if the patient underwent bypass surgery, but only depends upon the ejection fraction. If ejection fraction is more than 45%, his exercise can be started 2-3 weeks after angioplasty, as well as 8 weeks after bypass surgery. Thank you, sir.